All right. Um, Good evening, everyone, once again. Can someone confirm if I am credible, please?
Yes, good evening, sir. You're audible.
I would like to welcome each and every one of us to the First Connect World Tuberculosis Day 2026. And my name is Joshua Imani Belini. I'm from a graduate student of veterinary medicine at the University of Ibadan, the First Connect champion and the One Health Advocates. Be your moderator for today. While we wait for others, I would like us to kindly introduce ourselves, our name, and where we are joining from. Let us just make use of the chat box.
All right, let me start. Good evening, everyone. Hello, am I audible?
Good evening. You are audible. And speak.
All right. My name is Henry Nanmet. I'm an undergraduate student of veterinary medicine 400 level from Joseph Sawantaka University, Makurdi, Benue State. I'm a Vet Connect champion as well. Thank you.
Welcome, Henry. Thank you so much.
Thank you, sir.
Hello, good evening, everyone. I'm Janet Malone, a veterinary paraprofessional from Adamawa State, Nigeria.
Thank you so much. Thank you so much. So, without wasting much of our time, we just delve into the work directly. So, before I delve into that, I would like someone to tell us why we are observing or commemorating today's World Tuberculosis Day. I would like today's session to be much more interactive and engaging. So can someone just tell us why we are observing today's World Tuberculosis Day? We can also make use of the chat box. Hello, nobody is trying to tell us why we are commemorating today's um World Tuberculosis Day. All right. So as not to waste much of our time. So today's session is for us to we are commemorating the World Tuberculosis Day for us to kind of raise awareness to remember the impact of tuberculosis, to aid mobilized action against disease, and and this is our mission within the Vet Connect. We we um we are dedicated to a sustainable animal and community health, and we ensure healthier lives from animals and people alike. And so this is the major reason we are commemorating, sorry, today World Tuberculosis Day. Um, all right, thank you. Kisito, sorry if I didn't get that pronunciation. Is joining from Maiduguri, is veterinary professional. Thank you so much for joining us. Yeah. So without further ado, let's get straight to the point. Permit me to read the citation of our speaker for today. So um I would like if you can share that citation on the screen, please. If you can have it on the screen. Am I audible, please?
Yes, sir, you're audible.
I'm waiting for joining the additional.
Hello, me, I can't hear anything again. Is it only me?
Well, I am trying to wait for the host to share the citation of our speaker on the screen before I proceed, just for us to also read along as I proceed.
It's all right, sir.
Just all right. So Professor Charity Ashe Osla Agada is a veterinary public health expert specializing in zoonosis, particularly tuberculosis and brucellosis. She obtained a Doctor of Veterinary Medicine degree from Ahmadu Bello University, Zaria in 1992, and later earned a Master of Veterinary Public Health 2002 and PhD 2015 from the University of Ibadan. She is a fellow of the College of Veterinary Surgeons in Nigeria. She began her career in private veterinary practice before joining the Nasarawa State Ministry of Agriculture, where she rose to the head of Veterinary Epidemiology Unit. In 2025, she transitioned to the academia at the Federal University of Agriculture, now Joseph Sarwan Taka University, Makurdi, and progressed through academic ranks to become a professor of veterinary public health, zoonosis. zoonosis. Beyond academia, she is a managing director, CEO of the Unica Nigeria Limited, an agro-allied company, and serves as a trustee of the Yohana Asagaku Foundation, promoting girls' education. She has held several administrative roles at her university, including head of department. She is married with a daughter. Ladies and gentlemen, join me to welcome Professor Charity Agada to today's session. You can have the floor. Thank you very much. Please let's listen to Dr.
Good evening, everyone. I hope I'm audible.
Yes, ma, you're audible.
Okay, because my network around here, where I stay, not Makurdi, is a little bit unstable. So I'm not hearing you very loudly, but I just hope you can hear me. I want to thank you very much for having me here and giving me the opportunity to say my bit about um, the theme of World Tuberculosis Day of this year, which is yes, we can end TB. Okay, I would like to share my screen. I hope it's okay. Okay, are we all seeing my screen?
Yes, ma'am.
Okay, so I work with the Department of Veterinary Public Health and Preventive Medicine, College of Veterinary Medicine, Joseph Sawataka University. It was formerly Federal University of Agriculture, Makurdi, or some refer to it as the University of Agriculture, Makurdi. So I want to talk about the theme, yes, we can end TB, led by countries, powered by people. And because we are veterinarians mostly on this platform, I want to talk about my presentation on this with the following theme, the outline. Okay, we'll look at the veterinary perspective, the zoonotic importance of TB, and One Health approach. But before I'll continue, I want to appreciate, is it Temi Lokwe or that contacted me? He or she has been persistent in getting the information and then giving me this opportunity to make this presentation. I also want to appreciate the management of Konect for enlightening people and giving me also this great opportunity to talk my little bit that I know about tuberculosis. Okay, so TB is an infectious disease, usually highly infectious disease that is treatable and preventable, and is one of the most significant infectious diseases affecting both humans and animals. So it's very, very important. And that is why the theme, yes, we can end again. I think maybe the network. Okay. Sorry. My network is poor. I don't know. Okay. Are we okay now? Hello? Can you hear me now?
Yes, ma.
The volume is too low.
No, ma, it's okay. No, ma, we can hear. I can hear you too. Please.
It's
Go
very
ahead.
faint. Wow, I don't know. Maybe I may have to step outside my house so that I'll be outside since I'm sharing my screen. You may not be able to see my face, but you can see the screen. And I think that would be better so that we can get a better network. Or what do you say? Or can I continue?
Yes, Prof, ma, you are audible enough. We can hear you. I can hear you clearly.
Okay, so thank you. So from veterinary perspective, TB is very important because it's not only a public health concern, but it also have economic and food safety concern. Because in countries like Nigeria, we're always in close contact with animals, either in the rural settings, especially in the northern Nigeria. Before the onset of this crisis, you always have families having cattle at their backyard, either in one form of cattle fattening program or the other, or few. Some few families have a few they keep for milking. So not only cattle alone, we also have small ruminants around that we have at our backyard. So tuberculosis, from our own perspective, is very, very important. So when we want to talk about the causes of tuberculosis, it's caused by members of the Mycobacterium tuberculosis complex. As at 2027, we have about 11 species, but the ones that I highlighted in red are the ones that are most common and most important. Others are equally important and are of zoonotic in nature. But the ones that we have frequently reported and documented are these first three. We have the Mycobacterium tuberculosis, which is commonly referred to as the human tubercle. Then we have the Mycobacterium bovis, that is the zoonotic one that commonly affects cattle and other livestock, even wildlife and other animal species. Then we have the Mycobacterium africanum. Mainly that one is endemic in Africa, most common in the West African region. It has been isolated as the cause of tuberculosis in humans, and we also isolated it in animals, tissues, and even in milk samples. So the Mycobacterium tuberculosis is the one that affects man, and most of the time is the one being documented as the cause of tuberculosis. So, but we also have M. bovis, which is the zoonotic one. And most of the time, the cases about it is underreported. And that's the challenge we have. So we talk about epidemiology of the tuberculosis, just a brief epidemiology. Globally, TB affected over 10 million people worldwide in 2024. But as a result of as reported by the World Tuberculosis Report. Then 8 countries account for 2/3 of the global TB cases, and Nigeria is among them. Globally or worldwide, Nigeria is the 6th country worldwide having the highest burden of tuberculosis, while in Africa, it comes first. So we know that TB is really a problem in Nigeria. Then zoonotic TB, due to M. bovis, is a persistent and underreported threat. Most times they don't talk about it. As it has been documented that it accounts for 1 to 2% of all human TB cases. But take note that it's been underreported. So the percentage prevalence could be more than even the 2%, could be greater than that, but we have very few cases of documentation because we don't have facilities in the lab that can easily diagnose it very fast. So the zoonotic TB accounts for approximately 140,000 new cases and 12,000 deaths annually. In Nigeria, like I mentioned earlier, Nigeria ranked 6th globally and 1st in Africa of all the countries with the highest TB burden. So that is the problem that we have. And when we talk of zoonotic TB, we have so many factors risk factors that abound. We have high livestock and human interaction. We have very poor surveillance system. And we have the informal slaughter practices. People slaughter animals in their houses. We have villages, unauthorized places where we slaughter. So there might be high cases of the zoonotic tuberculosis that are underreported. How is TB being transmitted? It's transmitted through aerosol. Aerosol that the bacilli is released into the air when we talk, we cough, think, and so many other things, especially when we sneeze, cough, think, and the rest. If someone is affected, the person releases the aerosol into the air. And if susceptible individuals are around, they contract it. From the pictures we have on the slide, we're seeing a high congestion of cattle and human beings interacting. This is the situation we have in some of our cattle markets, where you have high level of interaction between humans and cattle. And during the course of that, a tuberculous cattle can sneeze into the air or cough. And humans that are in close proximity to such animals can easily inhale the aerosol that has the mycobacterium within, and it can get infected. Then we talk about consumption of raw milk. We've seen milking and even pastorally, whenever they are grazing, they drink from the cow directly. They suckle and drink. and so they can contact the infection. So consumption of raw milk or milk products produced from milk that has not been pasteurized. So also consumption of meat and meat products, especially meat products that are contaminated by infectious carcass. Like in the north, there are some of our meat delicacies that are not usually normally cooked, like the popular kilishi that we consume. The traditional way of preparing kilishi is by sun drying. We just cut the meat thinly and sun dry it. It's not passed through fire and the rest, except the recent ones that we observe. Traditionally, it's prepared by just sun drying. Then they apply the other things, the granite paste and all the other spices. They coat it with it. So most times it's not usually roasted, it's not even cooked. So tendency of if such meat is contaminated with the tubercle bacilli, the person consuming such meat will easily get the infection. Then carcass handling, like we talked about, look at this woman, this is a typical picture of Bodija abattoir in Ibadan. Now, they don't use Bodija, they use Akinyele, okay? Most times, the women are the ones carrying loads. So look at this woman carrying the meat, and the blood and everything about the meat is dripping on her. By so doing, she can also contract the infection. Even the butchers handling the meat in the abattoir, they can touch contaminated meat. And before you know it, they don't wash their hands. They just buy food and start consuming. And that is how the infection spread. This is a brief chat on how one can get infection. That's having contact with an infected cattle. The cattle release it by coughing, sneezing into the air. A human is exposed to that, inhales it, and gets infected. So what are the signs and symptoms of the disease? In humans, we have chronic cough, which is very painful. It results into chest pain. And then the cough is usually a prolonged cough. It's chronic and prolonged and can extend more than 3 weeks. So if someone around you keeps coughing and is coughing for more than 3 weeks, you advise the person to go to any of the TB centers where they can check for tuberculosis. And you have chest pain, prolonged fever. And another symptom is night sweat. The person coughs in the night, you see the person sweating at night. So that is a very typical symptom of tuberculosis in humans. Then you have unexplained weight loss. There might be enlargement of the lymph nodes, especially if one has the extrapulmonary TB. There might be enlargement of the cervical lymph nodes and also the lymph nodes. If superficial lymph nodes, if the organs affected are superficially, you can see that. Then the person will be tired, fatigued, resulting in loss of productivity. The symptoms in cattle is coughing, weight loss, enlarged lymph nodes, and reduction in milk yield. If you're raising the animals for meat, you also find out that because of the weight loss, what you're raising it for, you will not get the result. So those are the signs and symptoms of the disease in cattle and in humans and in cattle. So how do we diagnose it? Because our concern is zoonotic tuberculosis. In the field, we use the tuberculin skin test, where the bovine purified protein derivative is administered into the subcutis of the cattle, either at the cervical region, that's where we talk about cervical test, at the neck region, or at the tail, at the tip of the tail. But most times it's the neck region because most herders do not like the one administered at the tip of the tail because it results in the sloughing of the tail. So they don't always like it. So most times we go for the cervical one. And the comparative cervical test is where you administer the bovine PPD, that's to pick up that of zoonotic, that's the Mycobacterium bovis. Then you also administer that of the avian species to find out if the infection is as a result of the environmental or non-tuberculous TB, because some of them present signs and typical lesions as that of tuberculosis. So you administer the PPD, you take the diameter of the skin before administering it. Then 72 hours later, you come back and take the reading. So that's what we do for field diagnosis. Then in the laboratory, with culture and isolation, which culture is usually the gold standard. But you don't culture Mycobacterium species in any lab. There has to be a specialized laboratory, about safety level 3 lab, because like I said earlier, the organisms are highly infectious, and so we don't culture them anyhow. So it has to be in a biosafety lab. But we can run the Nelson staining, and with the Nelson staining, you usually have pinkish rods with bluish background because we use carbon fusil and methylene blue. So the bacteria absorb the stain, and when you decolorize with alcohol, it still retains this color of the carbon fusil. Then you counterstain stain with methylene blue, and you have this bluish background. So when you have them, you have rods. These ones are ZN staining of isolates from culture. So that's why you're having clusters. If it is direct staining of sputum and the rest, you will now see that it might be evenly distributed. They will also use the PCR technique, which has been even adopted in the TB centers for diagnosis. They use the hand test, which is able to pick up Mycobacterium tuberculosis. It can pick up Mycobacterium tuberculosis, Mycobacterium bovis, and Mycobacterium africanum. But most times, the cartridge they use to calibrate the PCR machine, most of the human clinics calibrate it for M. tuberculosis. So that is the challenge. Then, as veterinarians, we're involved in meat inspection. So at the abattoirs and the rest, we are the responsibility to detect our slaughter. And we know the granulomatous lesions of the tuberculosis are slaughtered. They are hard and red. But most importantly, I know we're told during meat inspection, when we're in our vet school, that when you see the lesions, you view, then you palpate, then you also incise. Using your knife to incise, it has a typical gritty feel and gritty sound, as if you're cutting through sand. And that is very, very pathognomonic for TB. So as a veterinarian at the abattoir, when you do that, you are able to pick the lesions. These are some of the lesions I have personally seen at the abattoir when I was running my PhD program and collecting samples in test tubes. So this one is in the abdominal region that you can see that is covered by tuberculous lesion. This is the liver, with also part of the GI, the intestine, small intestine, that you can see, and covered with the typical granulomatous lesions of tuberculosis. This one is the thoracic cavity, that you see part of the lungs and also the walls of the thoracic cavity being affected. So what we do is we check, and the carcass that have the lesions we condemn. If there are organs that it is generalized, I'm sure you know that you're supposed to condemn. But if it's affected just from organs, and you can trim and allow for partial condemnation. Okay, so how do we control and eradicate the TB, the disease? We have to get involved using the One Health approach, integrating both animals and humans as well as the environment. Because when I always tell veterinarians and also my students that taking care of animals, we're indirectly taking care of humans. Because when our animals are healthy and are disease-free, we're sure that the humans will also be disease-free. And so we have to look at it, the One Health approach. But there's a veterinary contribution to it. What do we do as veterinarians? The test and slaughter control policy. That one is very difficult to implement in our own environment. But in the developed world, that's what they have used to greatly control the disease. The test and slaughter. And the test and slaughter policies, they use the tuberculosis testing in farms, in herds. They go for screening, and if there's one reactor or two, they place the head as being suspect. They isolate the animal, take it, recommend for slaughter. At the slaughter, we carry out thorough meat inspection and confirm whether the animal is truly infected or not. So that's what they do. So they remove from the herd. And because they have what it takes to control and to compensate, they have been able to do that. But in our own environment, the aspect of compensation is not attachment to their animals. That even when you compensate, they will tell you that it will not be the same animals, because I've had farmers talking like that, that even if you give me money and ask me to go and buy, it will not be the same bull, it will not be the same cow. So that is the problem we have. So we need to do that. So movement control also is important. Restriction of movement of infected herd. They have used that very well in the developed world, that they place restriction on movement and they enforce the animal movement laws. We have it in this country, but it's just that when it comes to enforcement, we don't do that. So we also use milk hygiene. That's what we do here mostly, pasteurization of milk. And we have been able to create awareness. A lot of the pastoralists are aware now. They know that there's the need to boil their milk and the rest. So we need to still it's a continuous process. We have to keep educating them. But we have done that substantially, and we still need to continue to do that. Then the one that is very important that we can use in our own climate is abattoir surveillance. We have to be involved in meat inspection. When you see it, you condemn. There are times that some butchers may not allow you to do that, but it's very, very important for us to do and to condemn when we have such cases at meat inspection. That I told my students recently that there's a need for us as veterinarians to be friends with law enforcement agents, so that when their butchers are resisting condemnation and the rest, we can bring in law enforcement agents into it, and they will now enforce the law. Okay. So what are the control strategies that we need to do? Like we said, you detect. Most times in the farms, during test and slaughter, you isolate the animal, you take it for slaughter, and then you continue again, you go for surveillance. So it's a continuous cycle. Surveillance, as surveillance, you dictate. When you carry out the surveillance routine check of the herd, you dictate that there's an infected cow or a bull or cattle. You isolate, you take the cattle to the abattoir to slaughter to confirm. And if it is generalized TB, you condemn the whole carcass. But if it's just some few organs that are affected, you trim and pass. So that is our control strategy. What's our One Health approach to this? The One Health has to integrate the aspects of human, animal, and environmental health. So there has to be an integration for us. There has to be a joint surveillance system. It starts by the human health. If there are reported cases of zoonotic tuberculosis, that's why we use PCR. We'll be able to identify to species level. And then if there's an interaction between the animal health Ministry of Animal Health or Livestock Development and the Ministry of Health, if there's an interaction, they should be able to know, to report to the veterinary division or even to the research institution or even in the academia. Because once there are cases of human bovine zoonotic tuberculosis, using your PCR, one will be able to know whether the isolate or the strain of the bacteria that has been isolated from humans is traced, has been isolated within a given location. And it can be traced to know whether it is a local strain or it has been imported from another country. So we use the molecular techniques to do that. And also in the animal health, we research to investigate and also find out if the isolate or the strain of Mycobacterium bovis that we have, has it been isolated in humans, and what is the cluster of the infection? So when we have a relationship and interaction with the Ministry of Health or the Human Health and with the veterinarians, to be able to know, are these organisms or are these strains or species are they in isolation, or do we have a cluster, or are we having an outbreak or an emerging strain of a particular strain of the organism in circulation or in the environment? Then when we also liaise with those working with the environment, we also find out what are the forces. Are there contamination? Are there wildlife reservoirs of such infection of the disease? What is happening in the wildlife? Because there was a time in UI when they discovered that the wildlife, the lions in the zoo were dying. And when they performed postmortem, they discovered that they had TB lesion. And when they went further to try to isolate and also to characterize, they discovered it was the human tuberculosis. Yeah, it was the Mycobacterium tuberculosis that was affecting the animals in the zoo. So that could be as a result of occasion when they were allowing humans. They allow the UI zoo is usually open to the general public for people, children, for humans to come during holidays for excursion, to take animals, to come and view the animals in the zoo. And there's a probability that some of the humans that came might have been infected, and that was how the animals got exposed. And one cannot also excuse the fact that even the caretakers of the animals in the zoo may be infected and could have transmitted the disease to the animals. So that is why it's very important to have interaction between all these sectors and to share data and to share information and also to organize coordinated response strategy is very important. I hope my network is connecting. You people are getting me. I just hope so. So what are the roles of veterinarians in controlling TB? We talk about field and clinical roles, diagnosis and surveillance. That's where we play our role. We carry out routine surveillance and we diagnose. We are involved in meat inspection, especially. Then we're also involved in certification of animal health. Because when animals are imported or exported, Veterinarians have a role in certifying that the animals are healthy and in good condition. Okay. So what are the roles of veterinarians? As public health practitioners, we educate the people about the zoonotic risk of contracting TB. We go on public enlightenment campaign. As we carry out our studies, knowledge, attitude, and practice, we create awareness about the route of transmission and how it can be prevented, and where the people, if exposed or if infected, can receive treatment. They will also advocate for self-milk consumption when we talk about pasteurization and of milk and milk products. Okay. We also talk about collaboration with human health professionals. It's very important. Then we also talk about what are our regulatory rules. Enforcement of animal movement laws. We have our animal disease control law that has been signed into law by late Professor President Muhammadu Buhari in 2022. That law empowers veterinarians to enforce animal movement and also report diseases. So we can use that. So at times when you go, you discover that animals may be infected. So you see them transported from one part of the country to the other, and they sell it. And as a veterinarian, at the cost of your responsibility at the control post and even at the cattle market, you can insist that this animal is infected and should not be sold, should not be moved from one location to the other. Then those of us that are involved in meat inspection, we are supposed to report, send in our monthly reports, our quarterly reports to where we are working. And those of us, even in private practice, that will come across cases of TB, we can also report to the divisional livestock officer or veterinary officer of the area you're working, or directly to the director of livestock or veterinary services of your state. We are also supposed to be involved in educating the public about the disease and the zoonotic risk of the disease. What are the challenges that we have about the disease, about controlling, eradicating the disease in Nigeria? Number one is lack of funding. Even concerning research, we do not have funds, and even in work, the Ministry of Health and the Ministry of Livestock Development does not have enough funds. Like we talked about compensating, because government has stopped compensating. You see butchers resisting carcass condemnation or organ condemnation in the abattoir. So if we have enough funds, we'll still be able to control and enforce condemnation at the abattoir. Then the second one is weak enforcement of regulations. We have a lot of laws in this country that can help us, but when it comes to enforcement, we're very weak. We have cultural practices, raw milk consumption, one. Then there are times when you even go to the abattoir, you're trying to tell butchers that this organ or this carcass is infected and the rest. You see them in trying to demonstrate to you that nothing is wrong with the meat. They will cut a piece and put it in their mouth and chew. And that person has already exposed himself to getting infected. Then another one is inadequate diagnostic facility. We don't have enough diagnostic lab. We don't have level 3 diagnostic lab for us to go into culture and isolation. Even the molecular labs we have around, we don't have enough. Most of the research institutes or academia don't even have adequately equipped labs that could go into diagnosis. And lastly here, we have poor awareness. A lot of people are aware that tuberculosis is there, but they are not aware of the zoonotic TB. So we need to step up our game and create an awareness and get people enlightened about the disease. Okay? In concluding this talk, we need to understand that ending tuberculosis is very, very possible because it is a preventable disease, and right from children are administered the vaccine, the BCG vaccine. Then there are so many things you can do, like for zoonotic tuberculosis, you make sure that if you like to take milk, you make sure that the milk is pasteurized. You would like to consume meat, make sure that the meat is not contaminated and well cooked in such a way that the tubercle bacilla can be destroyed. Then veterinary role is very, very important. We have a very great role to play in combating and ending the TB epidemic spread. Thank you so much for giving me this time and giving me your attention. I just hope that with my poor network, you're able to hear what I've been saying to you. Thank you so much. Sorry, I think I have been so poor because I'm not even hearing the moderator now. Okay, I can hear you. Very thing.
Emmanuel, I don't know whether I'm the only one that can't hear you. You're speaking. I don't know. You're unmuted.
I'm sorry, I can't hear Emmanuel.
Emmanuel, I don't know if you can maybe rejoin the meeting if the network seems to be poor at your end. Okay, so why Emmanuel is about to join back, thank you so much, ma'am, for the wonderful presentation. We really got to learn a lot. It was so insightful, and for many of us, it's also a refresher of maybe the little we knew before the insightful presentation, man. Emmanuel, are you back now? All right. So Emmanuel, please let me know when you are back.
Can you hear me now, sir? Am I audible?
Yes, sir, you're audible.
All right. Thank you very much. Okay. Okay. Thank you. Thank you. So, we are going to be moving to the question and answer session. So, if you have any question for Prof, you can just unmute yourself or make use of the chat box, please. Hope I'm still audible.
Yes, sir, you're audible.
All right. Any question, you can just unmute yourself or send it to the chat box.
All right. It looks like Emmanuel's network is very poor. So we'd like to know if anyone has a question. I think we'd like to take questions now. So if you have a question, you can raise your hand, and the room will be given to you to ask your question. Please, can you Ayabo, can you confirm if you can hear me?
Yes, I can hear you.
All right. Emmanuel, you are back.
Yes, I'm back, sir. I can hear you loud and clearly.
Yes.
Yeah, and I can hear you too.
So
All
does
right.
that mean no one is having question? Okay. So I think I have question for Prof, sir. Ma, are you still with us?
Yes.
Okay, thank you, ma. So my question is, I have witnessed a scenario whereby veterinary doctor doctors on the farm were not able to perform their duties fully in a situation whereby the farmers as a result where they detect some
cases of tuberculosis on the in the abattoir, and these farmers are not able to, we're not ready to like to give away their animals. So in these scenarios, I think um a particular there is some kind of role which government have to play in this particular role. So I'm trying to like figure it out. What can the government do more to be able to solve scenarios like this, whereby the veterinary doctors, we see cases of tuberculosis on the farm being detected in cattle, but then they won't be able to fully perform their duties as a result of economic loss on the farmer. So what can the government do to be able to combat this kind of issue?
Okay, let me repeat the question so that I can confirm that I heard you correctly. You said veterinarians in the farm have come across some cases of TB and they've not been able to isolate the animals because the farmer is not willing to release the animal because of the economic reason. Is that what you said?
Yes, exactly, ma'am.
Okay. And you're asking what can government do to encourage the farmers or empower the veterinarians to be able to condemn or isolate, remove the animals from the farm. Is that so?
Yes, exactly,
Is
ma'am.
that your question?
Yes, ma'am. Yes, ma'am.
Okay. What government can easily can do to empower the veterinarians and also encourage the farmers to release their animals is when the government is willing to pay compensation. You know, if a farmer spends so much, let's say a young bullock now is around 250,000, and someone buys it, feeds it for more than 5 months or 6 months, and now a veterinarian is coming to tell him that maybe he's feeding it and targeting Christmas or any of the festivities. And a veterinarian now comes to tell him that I suspect that this cattle has TB and we need to isolate it. The farmer will fight you because he has invested his money. He bought the animals, he has fed the animals, he has bought drugs, he has maybe vaccinated, given supplements and the rest. And the animal is infected, and you want him to release the animals just like that, he will not be willing to do that. So government needs to fund this aspect, make the funds available so that they pay compensation. Like like I told you, in the advanced world, in the developed world, they compensate farmers. They may not compensate him to up to the worth of the animal, but they may compensate it maybe even more than 50% or about 50% of the worth of the animal. Do you understand? So if government does that, the farmer will not have difficulty in releasing it. But as a veterinarian, you also have a role to play. You can educate the farmer and tell him that if this animal is here on the farm, it will infect other farm animals, other cattle. That's number one. It will also infect the workers working with the animal. And secondly, assuming it's a cow and that is milking and the farmer consumes the milk, it can infect the farmer and his family. So when you educate him and show him the public health importance of separating the animal from the infected animal from the others, then you can also recommend that he takes the animal to slaughter. Because like I said, you take the animals to the slaughter. You slaughter, the animal may not have generalized TB. It may just have part of his organs, maybe part of the lungs or liver or any of the organs that is affected. So that one, you condemn the organs affected, and you can pass the other carcass. So when you enlighten the farmer, you appeal to his conscience and make him see that you leaving this animal on the farm is a risk, is a hazard, because his workers will be infected, his children may be infected, or members of his family, and even the other cattle that he has. He's exposing them to getting infected. And most times the farmer will see reason that if you take the animals to the slaughter, you may not lose the whole animal. You may get your money back. He may reason to that, listen to your reasoning, and will be willing to release the animal. I hope I've answered you correct.
Yes, thank you so much, ma. Thank you for the clarity. So we have some question on the chat box.
Okay, I've seen
Okay, someone
from
said
the chat.
after
It
recovery,
says if a
what is
human is infected, let me see from the chat box.
okay? Someone says after recovery, what is the percentage immunity of an individual?
Okay, if after recovery, what is the percentage in? Please, can you ask the question again? I didn't hear you well.
After recovery, what is the percentage immunity of an individual?
What is the percentage immunity
Of an individual?
after recovery?
Yes, ma'am.
The it depends, because the recovery, if the person takes the full course of the TB treatment, do you understand? If the person takes the full course of the TB treatment, the percentage is 50-50. I cannot tell you of a certain, because sometimes we have cases of reinfection. Do you understand? Of an individual that has been treated. That is when maybe the person have completed the course and may have some of the tubercles that are embedded in other organs, that maybe due to one condition or the rest, immunosuppression or immunosuppressive disease like HIV/AIDS, cancer and the rest, or stress, and we've had cases of reinfection. So sometimes it is not because the person has been exposed to another one, but it's the one that has not been cured completely. So that's why after taking the full course of the treatment, one goes for checkup to confirm whether the bacilli has been completely destroyed or not. Then one can be exposed to a different strain, a different species. But most times, if the infection is there, the person may not come I don't know how to, let me think of a word to give it. Even if the person is exposed to the infectious agent, coming down, like being severely infected, may not be as at the beginning. I hope I answered your question.
Thank you so much, ma. So another question is, if a human is infected, is it safe to go to work or school while still on treatment?
If the person is infected,
yes, ma'am. Is it safe to go to work or school while still on treatment?
For the first few months, if the person commences treatment, If the person is infected, like I said, through talking, through singing, sneezing, coughing, the person releases the aerosol. So most times, if the person is infected, he goes on isolation for the first 3 months. Once the person commences treatment, after sometimes the first month, before they will allow you, give you the go ahead to go to work, to interact with others, they will have to check the person's sputum, especially the person that has the pulmonary TB. They will check the person's sputum. If the sputum is dead end negative, it does not have the bacilli in the sputum, it means that he cannot spread the bacilli. So the person is allowed to go to work. But when he's in the active state of the disease, it's not recommended that the person goes around interacting with people, especially if it is the pulmonary TB.
All right. Thank you so much once again for your effort, your insightful session. We really, really appreciate, ma. And we're so honored to have you this evening on the call. Thank you so much, ma. So I think this is where we draw the curtain of today's session. And to everyone that are able to attend this session, thank you so much for your presence. We really appreciate. So this is where we are going to be drawing the curtain of today's session. Thank you and have a very nice time. Thank you.
Thank you very much for having me.
Thank you.
Thank you. Mhm. Mhm. Thank you.